Welcome to Biology My Passion. I am Soumya Harikrishna. We are learning the chapter Body Fluids and Circulation. Now let's see electrocardiograph or ECG. ECG is a graphical representation of the electrical activities of the heart. We know that SAN is producing some kind of electrical voltage which will pass through the AVN and it will help in the contraction and relaxation of the heart muscles or the chambers of the heart. So electrocardiograph is the process or the machine that we are using, and we are getting the result on a graph sheet that is called an electrocardiogram. It's a little confusing. Usually by seeing the graph paper we might think that is electrocardiograph and the machine is electrocardiogram. But the technique is electrocardiograph and the result that we are obtaining on a sheet of paper is the electrocardiogram. Now when you are studying ECG, that will show us the heart function. So by seeing the ECG, an expert doctor can easily identify what is the problem associated with the functioning of our heart. So usually for taking the ECG, there are 3 leads attaching to our body. 3 will be usually done on a standard one, that is both wrists they will attach one and there will be one to the left ankle. Then they monitor the activity. As a result, we get a graph like this. First there is a small peak, this is called a P wave. So P wave represents the depolarization of atria. Atria means what? The upper chamber of the heart. We know that during cardiac cycle, first atrial contraction or the atrial systole happens. So that is shown by this P wave. Then followed by that, there is the next wave, that is, this is called a QRS complex. This QRS complex tells us about the depolarization of ventricles, because we know that after atrial contraction, blood flows to the ventricles, immediately the ventricles contract. That is called a depolarization of the ventricle or excitation of the ventricles, which will pump the blood to the pulmonary artery and aorta. After that, the ventricles will relax. That is shown by this graph, that is T wave. T wave is the repolarization of the ventricles or the relaxation of the ventricle or ventricle diastole we can say. So, by ventricle relaxation, the entire heart will come to a joint diastole or joint relaxation. Then the next cardiac cycle will start soon. So this is the structure of a ECG. This diagram is important. Peaks are important. What do they represent also important. P wave, depolarization of the contraction of the atria. QRS complex, depolarization or the contraction of the ventricles or ventricular systole, and T wave, repolarization of the ventricle or ventricular diastillation or ventricular diastole. So in a given time period, maybe in 1 minute time, how many QRS complexes are forming? If you count that, you will get the heartbeat per minute. But for a normal heart rate, for almost all patients, the same kind of ECG will be available. So if it is a standard ECG, it will look like that. This will keep on repeating. This is one cardiac cycle. So this keeps repeating. But if there is a change in any of this, easily doctors can diagnose a problem with the heart function, and associated with which wave they can see where is the problem. Is it with the depolarization of the atria, or if it is the depolarization of ventricle or delaying of the repolarization of the ventricle. All these details can be derived from this.